Working on the back, I'm going to start off with rocking because I love it. And I don't think it gets enough love in the massage world. We tend to like massage somebody, and then the last 3 seconds we're like, rocky, rocky, rocky. Take your time as you're getting dressed. Like, that's it. Whereas rocking can actually be, I like to use it both diagnostically to see what's going on in the body. And then also I'm using it as treatment, because as I'm rocking down here with my hand right over the sacrum, her body is unwinding all the way up the spine, all the way down to her ankles. I can see them moving. So her fascia is unwinding while I'm just sitting here rocking. So go ahead and rock your client, take a look down to the feet, and you can usually see the heels moving, and just notice, is one heel moving a little bit more than the other? So like this side, is this the hip that was having problems? Okay. They're pretty even for her, but like one side's moving just slightly a little less. And you don't really know until you get in there, like, is it at the hip? Is it at the knee? Is it at the ankle? And then I'm going to look up here through the spine as I'm moving. Like, where does the movement kind of stop? For some people, it's mid back. Some people, it's upper back. Some people, it's more at the neck. Sometimes you can even see even a slight movement of the head as you're rocking them back. Just looking at my client here, and she's got even just a little bit of movement in her head. It's probably hard to see on the camera, but she's doing pretty good. We do get a little less like right in here. She's probably a little tight in there. All right, so I'm rocking at the sacrum, and then I can go over to the side, and I've just got my kind of knuckles on the side of the sacrum here. Just using a little bit of pressure too, because it's generally sore on most people. That's a good spot. And now I'm going to reach across the body to the other side of the spine, and I'm going to rock these erectors away from the spine. And I can use one hand, I can use two hands. And a lot of times, maybe you've done the move before where we're kind of in this lamina groove, and we get our fingertips and we're doing this, and we're trying to like get a little area in here. And it's really hard on our fingertips. So don't do that anymore. This one's almost just as effective and a lot easier on your body. And as I'm rocking, I kind of want to keep the rocking motion going. So here I am, I'm in her mid back and I'm rocking, and I've got that motion going all the way down. Her sacrum is still moving back and forth. And so that's kind of usually my goal, is I want to continue to make that happen. As I get further up towards the upper back and towards the neck, it's harder to make that happen. But it's still my goal to kind of like try. All right, I've rocked the erectors. I'm going to rock the ribs just a little bit. And so I'm going to come down here and be pulling the ribs towards me. And depending on the person, how far up you can get kind of on the lateral side of this scapula. Sometimes you can't really reach any ribs here if there's too much breast tissue. So you don't want to be like poking people in the breast tissue. So just be careful there. Then once here, I can kind of sneak my hands down the side just a little bit more, and then just feel with my hands. Okay, there we go. I've reached the bottom of the rib cage. Now I'm going to go over to the other side, do the same thing. I'm going to push on this side of the sacrum. And when you're rocking somebody, it's kind of like they're on a swing. And I don't want to like push her and then stop her before she kind of does that full all the way this way, all the way back. Because if somebody's on a swing and you stop them and try to push them before they've like reached their apex, it's uncomfortable. It's very jerky. So we want her to go all the way one way, all the way another way. Every body is going to be different, by the way. Everyone is going to have a different kind of rhythm on how far they go. Some people without hardly any body fat, they don't like swing at all. And then some people, you can do this really beautiful like back and forth. And I don't want to like impose my rhythm on them. I want the body to find its own rhythm, and then I'm just helping and supporting it instead of like doing really like soft and quick, and really like a really small, quick one. Like that's not as good as like a nice big rhythm back and forth, allowing the body to do that movement. It's also amazing for the nervous system, very calming when you think like, how we're going to get this baby to sleep? Well, we're going to rock them. Okay, that nervous system is like, oh, okay, I'll relax now. And it might feel to you as the massage therapist very boring, like, oh, I don't think I'm doing enough to earn $100 an hour. But if you ever check in with your client, they're just like, no, this is great. It feels amazing. I love it. The client is not bored. So now I'm going to come across to the erectors. I'm going across the spine to the other side of the erectors, and I'm just rocking them away from the spine. And the reason I'm going across the spine is then I can just lean into it, and I'm just using my body weight instead of using my arms. And then once again, the ribs. All right, so now I've really warmed up this whole